My name's David Wood. I just clocked up my 78th year. In 2002, I underwent an operation for a roughness on the inside of my lower right jaw, which I thought had been brought on by my ill-fitting denture. The operation was carried out. A small skin graft was taken from my thigh to cover the site, and a fortnight later, imagine my surprise when the surgeon said to me, unfortunately the biopsy has proven to be a squamous cell carcinoma. It was a bit of a bombshell. Cancer, a word which flashes through the mind, what do you do? It's the first time I've been in the hospital probably for 50 years. I asked him some questions and I wasn't totally convinced with his answers, and I said I would like to get a second opinion. Where do you get a second opinion? My GP said he didn't know anybody who specialised in mouth cancers. Not very helpful. Fortunately, my old dentist said, there's one person I would go to. He arranged an appointment and I went to see that person. And his attitude was reassuring. It was something he'd obviously faced before. I wasn't the first person, and the care and attention was apparent. We then had an operation later in 2003 on the lower jaw, and then I had an operation on the upper jaw. Unfortunately, in 2007, my brother had cancer of his tongue. Again, he thought it was roughness, and the dentist filed away at his teeth to try and make them smooth, but it was only the registrar in his local hospital who looked at his tongue one day and said, "Can you hang on a moment?" And he was operated 3 days later for 2/3 of his tongue to be removed. Unfortunately for my brother, it came back again after a couple of years and he died. The interventions one has, I used to call it cut and slash, actually. It changed the configuration of my jawline. There are no teeth, so I have a denture. But every time there's an intervention, it seems I've lost suction, and I then have to go and have my plate relined to try and give back some of the suction. This has been quite beneficial. In fact, I think I've got a better smile now than I had before all the surgical interventions. And I think for a lot of patients, this relationship between surgeon and them and the reassurance they can give is absolutely crucial, because believe you me, every time you go and have an intervention, you're waiting really for the answer to those biopsies when they come back. Is it clear, or is there more problems?
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organise research to improve patient treatment worldwide. Well done, Saving Faces.